Hello, my name is Krista. This educational video is a collaborative effort between Providence Sacred Heart Medical Center and Children's Hospital, the Region 10 Level 1 Special Pathogens Treatment Center, and Spokane American Medical Response, our dedicated EMS transport partner in Spokane, Washington. Together, our teams have developed the protocols in this video through a shared internal process based on nationally recognized best practices and informed by subject matter experts. We've partnered to produce this training video to help our teams coordinate seamlessly and provide excellent care to patients. Today, we'll walk through how to set up a donning station in any environment for EMS providers and demonstrate the donning process. This is for EMS personnel transporting patients by ground who are suspected or confirmed to have a high consequence infectious disease, like Ebola virus disease, Marburg virus disease, and Crimean Congo hemorrhagic fever, among others. Let's begin by setting up a donning station in a flexible location, whether that's an ambulance bay, a conference room, or even roadside. This setup is designed to be adaptable to any environment EMS providers may encounter while ensuring a safe and comfortable space to don high-level PPE. Joining me today are Cassie and Julie, who will demonstrate how to set up the donning station. The supplies we'll be using include 2 plastic folding chairs, 1 plastic folding table, a small donning kit which contains nitrile exam gloves, specific sizes to the providers, masking tape, bouffant caps, a Sharpie, hand sanitizer, and hair accessories, such as hair ties, croquis, or headbands. To begin, Julie and Cassie will place the folding table in the center of the space with 1 chair on each side. Next, they'll retrieve the donning kit, open the lid, and place it on top of the table. From the kit, they'll remove the hand sanitizer, masking tape, and nitrile gloves and lay them out directly on the table for easy access during the donning process. Now that we are all set up, we are ready to don our PPE. This PPE ensemble shown in this video is one of several appropriate PPE ensembles to care for patients with suspected or confirmed high-consequence infectious diseases. For consistency and caregiver safety, both Providence Sacred Heart and Spokane AMR use the same ensemble referred to as high-level PPE. The maximum duration a provider will remain in this ensemble is 4 hours to ensure safety and comfort. Our high-level PPE ensemble includes a level 4 fluid impermeable coverall with integrated boots, a bouffant cap if needed, internal boot covers, a Maxair PAPR unit with battery and belt paired with a level 4 fluid impermeable single-use hood, fluid-resistant outer boot covers, 2 pair of extended cuff gloves, a fluid impermeable apron, a radio headset for communication. Throughout the donning process, a trained observer will be present, guiding the caregiver step by step using a standardized checklist to ensure proper technique and safety.
All right, now we're going to prepare to don PPE. I want you to remove all your personal items, including your jewelry, cell phone, or ID badge, secure your hair and eyeglasses if needed, and use the restroom. We're going to start by performing hand hygiene. Next, we're going to inspect the PPE, ensure PPE is free of defects. Apply your belt and battery. When applying the belt, ensure that the clip is up, snug fitting, and secure the tail of the belt. Apply the battery to the belt on the left side. Next, we're going to test the PAPR function by plugging it in, ensuring that the battery indicator light comes on. Apply your comfort strip and check that the fan speed is on the desired setting. Disconnect your battery, apply the hood to the helmet. And then set your helmets outside. Next, we're going to don the headset. Apply the headset to the head and attach to the right side of the PAPR belt. Don your bouffant cap if needed. Don your inner boot covers. Don your coverall, but only up to your waist. Don your outer boot covers. Perform hand hygiene with alcohol-based hand sanitizer. Next, we're going to don the PAPR. Secure the cord under the battery and plug in the cord. Don the PAPR, assure that the cord goes behind your left shoulder. Make sure the PAPR fits properly by tightening the knob and shaking and nodding your head. Now I'm going to tuck the cord into the back of your belt. We're now going to put on the internal gloves. Next, you're going to don your coveralls. Pull the cuff of the coveralls over your internal gloves. Secure with the thumb and finger loops. I will come around and zip up the coverall. Be sure to remove the tab covering the tape and secure the tape over the zipper. I will now straighten the hood, tie both sets of ties in front. Don your external gloves. And then I'm going to come around and tape those gloves to your coveralls. Right, next we're going to have you put on your apron. And I'll come around and tie the back. All right, now I'm going to have you both turn in 360 degrees so I can make sure we've gotten all the PPE on correctly. Don your patient care gloves before making contact with the patients. These are your safety instructions. I would like you to keep your hands away from your face, limit the surfaces that you touch, sanitize your gloves immediately if they are soiled. Take your time. Ask for coaching if you need it. And if you have a PPE breach, notify the driver or your partner and the chase vehicle, then proceed to the doffing process.
You are now fully donned in high-level PPE and prepared to safely transport a patient with a suspected or confirmed high-consequence infectious disease. Key components of this process include following an established checklist with the support of a trained observer and committing to teamwork to ensure a safe and effective care environment during transport. Your attention to detail and commitment to safety are essential in protecting yourself, your team, and the patient during transport.